Good morning, everyone. Today we're going to be starting the lower extremity. So we just finished upper extremity, and now we're going to be taking a look at basically the same type of stuff, but for lower. So in this case, we'll look at the bones for today, at least in the hip joint. So let's go ahead and get started by taking a look at, well, the pelvis. Alrighty, so to start off with, let's go ahead and take a look at what we have here with the osteology of the pelvis and its supporting structures. This will be looking at the pelvis itself, which includes the coxal bones or the os coxa, as well as the sacrum and the coccyx. So together you actually have 4 bones that make up the pelvis, which is then going to articulate with the lower back bones of the vertebra, as well as your femur for your hip joint. If you look closely, you can see that you have the lower extremity in this case, and we will see a lot of similarities to the upper extremity, but the lower extremity will be obviously a little bit different. So in this case, you don't have scapula and humerus. For the hip joint, at least, you have the coxal bone or the os coxa, and then also the femur. But then if you look at the pelvis, there are 2 sides to the pelvis, but then there's also a couple bones that are missing here, which would be the sacrum and the coccyx in the back. But further down, we will eventually see that there are not just the thigh bone, the femur, but also the leg bones, which are going to be the tibia and the fibula, as well as the knee joint bone or the kneecap bone, which is the patella. And then there will be foot bones and then toe bones as well, which are including tarsals, metatarsals, and then phalanges again. So let's go ahead and get started by taking a look at one of the major and most unique bones of the pelvis. This is going to be the os coxa, or sometimes known as the coxal bone. So to be honest, I would be okay with either one, but here's the coxal bone in this case. And if you look closely, like there are a few different major regions of the coxal bone. So up here, this is called the ilium, this large fan-like shape. But then you have the pubis, which is going to be in the front. And then you have the ischium, which is going to be in the lower back portion. So I know that these 3 bones, at the very least, when you look at it in lab, at least, it'll look like it's all one bone. That's because they actually kind of fuse together. So they fuse together and they form a very strong joint within this bone, or rather, like just the bone in this case. And then if you look closely, like there are kind of like edges that would allow it to fuse together. But to be honest, we're not really going to be able to see that very well. But these bones will fuse together. And then around age 20 to 25, even, like maybe some of you don't even have this yet, but they'll completely fuse together. So a good thing to look for is that they kind of form like a Y shape, which is called the triradiate cartilage right over here. So this is the fusion lines, the triradiate cartilage. Now our first part of the coxal bone that we'll look at is called the ilium. And the ilium is probably the one that's, well, it's the biggest and it's the most prominent part of the coxal bone. So to get started, like this middle portion of the coxal bone where everything kind of extends off of, like that's very, very generally called the body of the ilium. But then there's a lot of little crest, spines, notches that come off of this. So to get started, the top portion right over here, this rounded part at the top, this is called the iliac crest. So the iliac crest is going to be all the way up here, which is forming that arch at the top of the ilium. But look at the front or back of the iliac crest, and that is where you're going to find 2 pairs of spines. So if you look closely at the very anterior edge of the iliac crest, this one right here is called the anterior superior iliac spine. And hold on, let me just make an arrow so I can point things out a little bit easier. All right, so this right here is the anterior superior iliac spine. And that is, as its name suggests, the top, but also the front spine of the pelvis. But if you have an anterior superior iliac spine, you also have an anterior inferior iliac spine. So you have two spines on the front of the ilium, anterior superior, anterior inferior. Now you actually have the same type of thing on the back side. So looking at the iliac crest, here is the back side, and you can see that you have a pointed region right over here. This is called the posterior superior iliac spine. And once again, a bottom one as well, posterior inferior iliac spine. So those are going to be oriented to the iliac crest, either on the top or bottom, front or back. Now, if you look closely though, there are also these lines that are coming off of the side of the ilium. They're somewhat faint, so they're kind of hard to see sometimes. But if you look over here, you can see one right, well, not right in the middle, but generally in the middle. This is going to be called the anterior gluteal line. So the anterior gluteal line, that's going to be this pretty big one. And then posterior gluteal line back here, it's actually going to kind of go along the iliac crest, but then stop about 2/3 the way down over here. This is going to be the posterior gluteal line. And then down here, you have another one. This is the inferior gluteal line. Now, being in the hip region, I mean, the word gluteal probably brings up some imagery, but this is going to be like regarding the butt region, the posterior hip region. And then, as you probably have guessed, this is where like gluteal muscles are going to be attaching to. So gluteal lines, they're not super distinct sometimes, but if you look closely, you can definitely see them. So looking at some other stuff, if you look closely, maybe over here. Taking a look at this really big thing right back here. This is going to be not necessarily, well, it's not a process, it's not a spine. This is a notch. This is called the greater sciatic notch. And if you've ever heard of the words sciatica, or if you've ever heard of the words sciatic nerve, this is what it's referring to. So the greater sciatic notch, this is where like the sciatic nerve will be running, but we'll look at the sciatic foramen there as well. Now to take a look at the medial side. So sorry, I even got ahead of myself. If you look closely, this right here is where you have something called the acetabulum. This is where the femur is going to insert into so that you can have like this very well-fitting ball and socket joint. When what that means is that, similar to the glenoid cavity and the head of the humerus, this is the lateral side, which indicates that this over here, without the acetabulum, is the medial side. Now, looking at the medial side, though, you can see a few things. So this one right here, this is called the iliac fossa. So the iliac fossa, this is a depression right along the inside of the ilium. So this is kind of like giving it a somewhat curved appearance. But then at the bottom of the iliac fossa, this is where you'll find the arcuate line. So the arcuate line is near the bottom of the iliac fossa. And then if you look back here, there's a couple of things that you'll be able to see as well. So this roughened region right here is called the iliac tuberosity. And this is actually partially where you'll see it connecting with the sacrum, but even more so, you can see the auricular surface down here, where it's going to really articulate with the sacrum on its sides. So imagine you have the ilium or the ilium bones on the sides of the pelvis. You have the sacrum that's going to be connected to them in the back. So you have the iliac tuberosity, you have the auricular surface, and then you also have this over here, which technically is kind of like with the iliac fossa, but the whole thing we're going to be calling the ala. So I feel like I'm missing some, but okay, so one more that I can see that I didn't mention up here. So here's the iliac crest again, and then in the middle, near the top, on the outer edge, this is where you're going to find the tubercle of the ilium. So the tubercle of the ilium, you can see right over here. This is going to be right along the superior and then lateral part of the iliac crest. Now moving on to our second part of the coxal bone. Luckily, a lot less things on it, so that's really good, but also let's just point it out, which is this lower part right here. So it's the inferiormost part of the pelvis, and as well as like the inferior posterior side. So if you imagine like when you sit down, you are sitting down on your ischium for the most part. So this is the ischium. And this is where you'll see, once again, a couple of spines and notches. And if you look closely, right over here, this little pointed part right under the greater sciatic notch, this is the ischial spine. So spines are usually like more pointed like that. So ischial spine, pointed process in this case, but right under the ischial spine, this is called the lesser sciatic notch. So you had a greater sciatic notch, that's this big one. Lesser sciatic notch is this small one. And then if you look over here, this is called the ischial tuberosity. This big part, like all the way in the back and bottom, this is going to be where you have muscles attaching to it. But then furthermore, down here, it kind of like forms this skinny bridge-like region. This is called the ramus of the ischium, or ischial ramus. So you can't see quite as much from the medial side, but you can still see ischial spine, lesser sciatic notch, ischial ramus, but then ischial tuberosity is not as visible, but it's technically still here, right there. Now moving on to the pubis, this one is unassumingly a little bit complicated, but if you look closely, the pubis is on the anterior side. So in the front of the pelvis, this right here is the pubis, and that's where you're going to have the two pelvic bones or the two coxal bones actually meeting together. So the two pubic bones meet at the front to form what's called the pubic symphysis. So like the back of the pelvis has the sacrum and the coccyx, but the front of the pelvis has the pubic symphysis where the two pubic bones will meet. And the large part of the pubis right over here, this is going to be the body of the pubis. But then if you look at the top over here, this is where you'll see a couple of different landmarks. So the first of which right here, kind of like near the medial anterior superior side, this is going to be called the pubic tubercle. So the pubic tubercle is going to be right over here. And then right next to it, looks like it doesn't have it labeled, but right over here, kind of along that upper edge next to the pubic tubercle. That is going to be the pubic crest. And then you also have the pectinate line, which is going to be very close to it. So the pectinate line will be right over there as well. So let's see. Actually, you can see it a little bit better here. Here's the pectinate line over here, which is kind of like on the upper edge of the pubis. But like the ischium, there's also those bridge portions, a bridge portion that actually goes from the pubis to the acetabulum, as well as pubis to the ischium. This is going to be the superior pubic ramus and inferior pubic ramus. So looking at the pelvis, there are some kind of like interesting things that you'll see here. So some special stuff that you'll see will include the inguinal canal, the obturator canal, and the greater and lesser sciatic foramen, which are formed by the greater and lesser sciatic notch, but also some ligaments that we'll be introducing as well. But these are basically going to be mostly spaces that stuff is going to be able to travel through. So if you look closely, this band right here going across the front of the pelvis or front of the iliac or coxal bone from the pubis to the anterior superior iliac spine, this is called the inguinal ligament. So the inguinal ligament goes across right here, and if you look closely, there's this big arrow going through here. That's where you'll have a lot of major stuff going through there, such as the external iliac artery and vein, as well as the femoral nerve. And then you have the obturator canal. The obturator canal, you'll be able to see right in here going through a hole, which is called the obturator foramen. And this is going to be where you have the obturator nerve, as well as blood vessels going through. And then the lesser and greater sciatic notch, those are on the back. So all the way back here, this is where you'll have the greater and lesser sciatic notches. And that's where you're going to have various things going through, such as the sciatic nerve. Now, hold on. I guess let's just look at this while we have a whole pelvis. Here are your two coxal bones. And then in the back here, this is where you have the sacrum. And then furthermore, you can also see the pubic symphysis, where the two pubic bones meet in the front as well. And then not shown, but there's a small group of fused vertebrae at the bottom called the coccyx, which make up the tailbone. So let's go ahead and take a look at the sacrum next. And the sacrum also has its own landmarks as well. But this right here would be the sacrum, which is basically a few fused vertebrae, which we haven't talked about vertebrae yet, but they have like very distinct characteristics. So some of which is that there will be like different parts of the vertebrae. Often you'll see that there is a body of the vertebra, which is very thick and kind of robust. But then there are a lot of spinous processes that come off of it, as well as articular processes that go up above and down below to connect these vertebrae as well. So let's go ahead and take a look at the sacrum, which is this region right here, with the coccyx down here, the tailbone underneath. So to start off with, this right here is where you'd find the vertebral body, and this is where you find the sacral promontory. So this right here, the sacral promontory, this is at the top of the sacrum, which is where L5, your fifth lumbar vertebrae, is going to have its vertebral body resting on top of. And this whole area, including the sacral promontory, is going to be the sacral base, or the base of the sacrum. So the base of the sacrum is the wide portion, and then if you look closely, it forms like a pointed part as it goes downward. That is going to be called the apex. So the apex is the pointed part, the base is the wide part. Now this is the anterior view where it's kind of like relatively smooth, but the posterior side is where it gets like rough and bumpy. And this is where we'll see some significant bumps, which is where a lot of stuff is going to connect. And in the middle right here, this is going to be called the median sacral crest. So median sacral crest, that's going to be going right down the midline of the sacrum with these like prominent bumps. And the lateral sacral crest, you can see over here and over here, those are slightly lateral and to the sides of these holes or foramina. So these will be the sacral foramina, which are going to be going through the sacrum, which is where various nerves will be able to travel through. Now, something that might sound familiar is that on the sides of the sacrum, there are these surfaces that will allow for articulation. These are going to be called the auricular surfaces. So the auricular surface of the sacrum, you can see on the sides here, and which bone had the auricular surface? Like one of the coxal bones had an auricular surface. Try and think about that just for a sec. Which one was the biggest one? The one on the sides of the coxal bone, the ilium. So hopefully you were able to remember that. But the ilium and the sacrum will have their auricular surfaces that allow them to articulate. So this would be the anterior side. This is the dorsal side. And then if you look closely, there's also a few more things to look for here, which include these regions, like somewhat lateral or directly lateral to the lateral sacral crest. These roughened regions are called sacral tuberosities. So sacral tuberosities, that is going to be roughened regions similar to like a deltoid tuberosity. So this is where things will be able to attach. So specifically, as we'll see, ligaments. But if you look at the top here, there's actually a hole. Oh, actually, you can see it here. This hole in the middle is where nerves will travel through, like from the spinal cord, not necessarily like the physical spinal cord, but nerves that come from them. This is going to be called the sacral canal. So the sacral canal, that's going to be up here. And then the sacral cornu, so sacral cornu, those are going to be down here where they articulate with the coxal bone. So there will be parts that extend downward to the, sorry, not coxal bone. So the parts that extend downward to the coccyx, to the tailbone, will be the sacral cornu, which you'll see you have cornu on the coccyx as well. And then if you look above up here, what will help with connecting to L5 are the superior articular processes. So basically, these vertebrae or these bones that are on top of each other, I mean, they will sit on top of each other, which is good, but they have these other parts, which are called articular processes, or cornu in this case, that will help with keeping them aligned. Now, leading down to the last part of the pelvis bones, at least, we have the coccyx, which is going to be this small group of bones down here, which includes the base, the broad part, the apex, the pointed part, and then the cornu, which once again is going to be the parts that extend upward in this case to connect with the cornu of the sacrum. All right, so in this case, we can see the joints that are like forming the pelvis, which is going to be where all of these bones connect basically. And that is going to include the one on the front, which is called the pubic symphysis, and then the ones on the back, which are going to be the sacroiliac joints. And I might as well introduce a word which is innominate. Innominate is sometimes used to describe the pubic, or sorry, not pubic, the coxal bones because of their odd fusions of their names, I think at least. So innominates, like that's going to be what you may sometimes see being referred to as your coxal bones. So you would have like two innominate bones, your coxal bones on your sides, and then you would have your sacrum and your coccyx in the back. So when you look at this, you can see that you have your pelvis, but once again, can you find sacroiliac joint and pubic symphysis? And luckily, there's some pretty big landmarks that help you to do that, which is, in this case, you can see the obturator foramina, the skinny pubic bones. This is pubic symphysis. And then this back here, this kind of weird looking triangular shaped bone is the sacrum. This is the ilium that connects to it. So this is sacroiliac joint. Now, you also have a joint between the lumbar region and the sacral region. So lumbosacral joint is where the lumbar bones or the lumbar vertebrae and the sacrum are going to be able to connect. So in this case, you have 5 lumbar vertebrae, meaning that the 5th lumbar vertebra is the one at the bottom. And that's the one that's going to connect to the sacrum. So if you look closely, this one down here is going to be lumbar vertebrae number 5, which sits directly on top of the sacrum. And you can see these parts that are kind of like interconnecting between them. So this part right here would be the inferior articular facet of the lumbar vertebra, and that is connecting to the superior articular facet of the sacrum. So you have a couple of different joints here. The one that's where the body of the lumbar vertebra connects with the sacrum, that luckily is going to be the intervertebral joint. So between the vertebra and the sacrum, intervertebral joint, which means between the vertebrae. And then you have one that's a little bit weird to say, which is oh my gosh, zygapophyseal. So zygapophyseal, that's going to be where the articular facets articulate with the other articular facets. So it's weird, but the inferior articular facets of the L5 articulate with the superior articular facets of the sacrum. So those are going to be the oh my gosh, zygapophyseal joint. So when you look at these, the intervertebral joint does allow for some movement, but it's largely going to be a cartilaginous joint. So if you look closely between the vertebrae, these are otherwise known as intervertebral discs, which we'll talk about later, but that's similar to what you see down here, which is a symphysis joint, similar to a pubic symphysis. So this does allow for some movement, but not like a lot. And then the zygapophyseal joint, that's also going to allow for some movement, but a little bit more than the intervertebral joint. So finally found a word that I have a hard time with, zygapophyseal. So, but practice makes perfect. You can do it too. So lumbosacral joint, like you can see that you have those 2 major parts articulating, but you can also see that there are ligaments as well as connective tissues that are connecting them as well. And hold on. All right, looks like we better talk about those now. So once again, I actually talked about this before, but you have the intervertebral disc right over here. This is where you're going to have the fibrocartilage that is going to be between the vertebral body and then the promontory of the sacrum. So that's kind of like the top of the sacrum. That's where those two will be able to connect with two very flat surfaces. Now, in this case, you have a couple of different ligaments as well. So if you look closely over here on the sides, these are going to be the iliolumbar ligaments. So iliolumbar ligaments, those are going to be from the transverse processes of L5 to the pelvic surface of the ilium. And then you also have these ligaments that are going to be kind of along the vertebra more than anything. So if you look on the back of the lumbar vertebra, so just to be clear, we took off this posterior part of the vertebra so you can see the back of the body of the vertebra. This is called the posterior longitudinal ligament. So the posterior longitudinal ligament is going to be in the front over here. And then you probably have guessed that you have an anterior longitudinal ligament in the front. So these are kind of connecting along the anterior and posterior sides of the vertebra to help with just keeping them oriented and correctly connected. So besides that, though, you also have the interspinous ligaments, which are going to be from spine to spine. So from spine to spine, this is, well, here, you can see it here. From spine to spine, interspinous ligament. And then this one is not shown here, but from the transverse spine, you have intertransverse ligaments. And then if you look closely, right down here, you have ligamentum flavum, which helps with connecting like lamina to lamina. So we'll talk about the lamina later, but this is what's connecting kind of like the dorsal side of the vertebra, but not from the spine. So that's the interspinous ligament in that case. So you have ligaments basically all around the vertebrae, the front, the back from each of the different spines. And luckily, like once again, think about inter and what they're connecting. So usually it's not too bad to remember, at least for these. Now, the next joint that we have here is called the sacrococcygeal joint. And sacrococcygeal, what does that connect? Sacrum to coccyx. So sacrum to coccyx, this is going to be down here, connecting between the two. And there isn't a lot to connect, but you do still have like these small little coxal bone or coccyx bones that are going to be connecting to the sacrum. So the coccyx isn't really that important to us. I mean, it could definitely get broken and bad things can happen, but it's not as functional. So we don't have quite as much like going on here, but you can still see the cornu attaching to each other. But then you also have a couple of different things. You have a couple of little ligaments here, but those are going to be like sacrococcygeal ligaments. So that's going to be helping to connect from sacrum to coccyx. Now our next joint is one of the bigger joints that we have here, which is the sacroiliac joint. So sacroiliac joint is going to be where the sacrum and the ilium kind of, well, they don't fuse, but oh, they kind of do, but they're going to very strongly connect to each other along the auricular surfaces. So sacrum over here, ilium over here, and the two auricular surfaces will meet with each other over here on the side. So you do not really want this to move very much. This is going to be a somewhat stable joint because you don't want your pelvis to come apart. Like other bones you might want to move, but this one, not so much. Now, between the sacrum and the ilium, there are a few kind of like different ligaments that are a little bit hard to see together. So if you look at these pictures, you can see them a little bit more clearly. So interosseous anterior sacroiliac ligament, that's going to be over here. So this one right here on the front of the pelvis, or rather the front of the back of the pelvis, but anterior sacroiliac ligament, this is going to be on the front of this joint. And then on the back, there's a few different ligaments. This one over here, first of all, is the interosseous sacroiliac ligament. This one is somewhat deep in this joint. So when you look at these, it's a little bit hard to see unless you were to look at it on its own. But then if you look here, you have some smaller ligaments, which sometimes can be shown a little bit variably. But these top ones are going to be the short posterior sacroiliac ligaments. And then these kind of diagonal ones will be the long posterior sacroiliac ligaments. So short ones are the ones that go across. Long ones are the ones that are going to be going more downward. Now, to talk about a couple of different ligaments that we'll see here as well, these are much more external, but very important as well. These are going to include sacrotuberous ligament as well as sacrospinous ligament. Now, sacro, we've been saying a lot, that's referring to the sacrum, but sacrotuberous is referring to the tuberosity, specifically the ischial tuberosity. So you can see the ischial tuberosity right over here, connecting from the sacrum. This is going to be the sacrotuberous ligament right over here. So this is going to be from the sacrum down to mostly the ischial tuberosity, but you also have a sacrospinous ligament as well. So sacrospinous ligament, that's going to be over here, which goes from the sacrum to the ischial spine. So this sacrotuberous ligament is actually bigger than it seems, though. It goes from the sacrum to the tuberosity, but also it comes kind of like all the way up here from posterior superior iliac spine and inferior superior iliac spine down to the sacrum and then to the tuberosity. Now, using these different ligaments, you're going to be able to see that there are a couple of spaces that are going to be formed. And you can see a couple of landmarks that we also talked about. So this is the back of the ilium, and this large kind of like hook, this is the greater sciatic notch. And the greater sciatic notch is going to form a hole with the ligaments, which is called the greater sciatic foramen. So the greater sciatic foramen is going to be formed by greater sciatic notch, but also by the sacrotuberous ligament, as well as the sacrospinous ligament down here. And then the lesser sciatic foramen is going to be formed by lesser sciatic notch, as well as the sacrospinous ligament and sacrotuberous ligament once again. So this is where the sciatic notch will travel through and innervate a lot of your, or be responsible for going down to a lot of your thigh, but then branch out to your leg muscles as well. So lots of stuff. Like we'll talk about these later, but here's a lot of fun words for you to at least browse over. But we will be looking at these a lot more specifically. So just to give you a few examples, like first of all, greater sciatic notch, the big one, sciatic nerve, but then there's also like the superior and inferior gluteal neurovascular bundle. So superior and inferior gluteal artery, vein, and nerve. the piriformis muscle, which you can see right here, which is actually going to be very strongly associated with sciatic nerve as well. Pudendal nerve, which is going to be a nerve that goes into the groin region. Pudendal blood vessels that go to the groin region. And then a couple more nerves that go to muscles, such as obturator internus and quadratus femoris. I guess we might as well just finish up and talk about the rest. Here's the lesser sciatic notch, which is where you'll have, once again, pudendal nerves. So pudendal nerves, pudendal blood vessels, but then you'll also have the nerve that goes to the obturator internus, as well as the obturator internus tendon as well. All right, so looking at the sacroiliac joint, it is going to have a couple of odd, or not odd, but a couple of different kinds of movements similar to the scapula. And this is going to be, like the scapula, different types of tilt. So you have anterior tilt and posterior tilt, which is where it either tilts kind of like forward together, back together. So anterior and posterior tilt, relatively clear, but antagonistic innominate tilt means that when the when the coxal bones kind of tilt differently, depending on the side, that's going to be antagonistic innominate tilt. So that word innominate, remember, kind of refers to the coxal bones because their names are a little bit odd. So these can be used, or like these can be described a little bit differently. Sometimes you might see these type of movements or these types of names as well. So nutation as well as counter nutation, but we can see that we have anterior, posterior, and antagonistic innominate tilt. So let's go ahead and take a look at these where it's a little bit different from most other movements. So when you have like your neutral position of the coxal bone, the pubis and the anterior superior iliac spine should be along the same vertical plane. But if you were to tilt it forward, as in like tilt the top forward, that is going to be anterior tilt. And then if you tilt the whole thing back, that is going to be posterior tilt. So this is a bilateral movement, meaning that both sides move together, which is going to be making it bilateral, or just specifically anterior and posterior pelvic tilt. And there are muscles that kind of pull on these different bones or these different parts of the bones to do so. So kind of like the scapula, like it's really kind of the same thing, but if you look closely, here is your rectus femoris, one of your quadriceps muscles. It's going to pull the front downward to cause anterior tilt. Or you could pull the back upwards using a rectus spinae to pull it or to tilt it forward as well. And then the opposite, where you have your gluteus maximus or hamstrings muscles pulling the back downward, tilt it upwards or back, and then having the rectus abdominis pull the front upwards will do the same thing. So tilt, similar to the scapula. So I cannot do this in this room. So please try it out. But like you can tilt you will tilt your pelvis along with different movements, such as extension and flexion of the lumbar region, as well as like extension and flexion of the hip joint as well. Now getting to the end of the pelvis, at least, you have the pubic symphysis. So pubic symphysis, this is a joint that connects the two pubic bones. And this is a bone or a joint that is not very mobile. And this joint is actually a different kind of joint from synovial. So finally, I mean something different, but this is a cartilaginous joint. This is a symphysis joint. And just to be clear, so are the intervertebral discs. They're both fibrocartilage that is going to be between bones as basically a like plate of cartilage between the bones in this case. But if you look closely, there are a couple of ligaments on top over here. That is going to be where you find the superior or suprapubic ligament, and then a ligament on the bottom, which is called the inferior arcuate pubic ligament. Now, the pelvis is also kind of unique in that it forms like a large circle or large opening, and these will likely be, or these will be known as like the pelvic inlet and outlet, but they will also have some more specific boundaries as well. So to start off with, the pelvic inlet is basically where everything kind of goes into the pelvis. But just to look carefully, there's actually kind of like a subdivision within here as well. So if you look closely, you can kind of consider the opening all the way over here along the edge, like the outer edge with the iliac crest, or you can consider the opening right here where you can see like the actual space going through it. So these are going to be known as the the true or false pelvis, because one of them is like a little bit misleading in the amount of space that they can go through, and then one of them is the actual space that can go through. So we'll talk about that in just a sec, but this would be the pelvic inlet on the superior aspect of the pelvis, and then the pelvic outlet is the bottom portion down here. So you can see that in these colors, they're a little bit different. So the greater pelvis or false pelvis is formed by the the iliac crest over here, all the way along the edge. But then the true pelvis is going to be in here, which is going to be like the pelvic brim. So the pelvic brim, this is going to be the actual space that can travel through here. So for instance, like when you think about a baby going through here, you don't want to think about the false pelvis. Like the baby might get there, but if it like can't get through the true pelvis, then you are in trouble. Like that is not going to work. Like the actual space that can travel through the pelvis is the lesser or true pelvis. So here you can see that you have the lesser pelvis, or sorry, the greater and lesser pelvis formed by the greater or the iliac crest over here. But then you also have the lesser pelvis or the true pelvis formed by, in this case, the arcuate line of the pelvis, or sorry, the arcuate line of the ilium. So those are kind of like the different borders, but they all share like the pubis in the front and the sacrum in the back. Alrighty, so I'm going to be making another lecture for the femur as well. So let's just stop this one for now so we can break it up a little bit. Take a break, come back, and we'll talk about the femur and the rest of the hip joint too.